Well, today we'll speak about psychiatry, and so this is the unit 9 of the book. So I think it's just more interesting for us now. And so let us start with the first slide, and you'll tell me if you can see the slide. So it takes some time. It's like the connection is lost.
We cannot see the PPT.
Just let us try one more time.
Now it's visible, ma'am.
Yes, ma'am. Now it is visible.
So let us just do like this. I don't know. So can you hear it now? Can you see the presentation now?
Yes, ma'am.
Yes, ma'am.
But not in the full
I see.
screen, ma'am.
Well, let us just push like this. So can you see the second slide?
Yes, ma'am.
Yes, ma'am.
So I would like to say some words about your previous task, and there are some comments on the video task. So I would like to say thank you so much for your sincere stories. So about your personal experience that made you wish to become a doctor. So the stories are very touching and inspiring. And so a lot of students talk about pros and cons of the medical professions. Doctors save people's lives, and they are respected in your country. It can be compared to God. So, and I've learned there is a saying that in your language that so doctors are the second after God, right? So, and people trust doctors. They have huge gratitude to doctors. And some of the students say that on the other hand, some doctors work illegally with organ transplantation, and this is the dark side of the job. And so I hope that video task has helped you to reflect on why you want to be a doctor, and just the mission of this profession in society. And there are some citations from your videos about being a doctor. So everything you are doing, you do it with all your heart, and doctors are another form of God, and it's the best profession to serve people. So thank you very much for those students who have done. Unfortunately, not everyone has done the task, and you see, so some of the students haven't made the previous video about their, what was that, strengths and weaknesses, and the second video about becoming a doctor. And so you lose your score. So I don't know the reason why haven't you done this. So if you have any technical issues, please ask your group mates to solve them, or just send the video to me in personal message. but anyway, do it. And so here I was disappointed by the results of the grammar, the grammar task, where you were given the task to work with sentences, conditional sentences. And here are so the sentences, and some of them have mistakes. Let us have a look and analyze the sentences. You remember that we were speaking about first conditional and second conditional structures. The first conditional expresses the real condition, so which can happen in real life. And the second conditional structure is hypothetical and real situation. So, and the markers of these structures are the forms of the verbs which are used in the if clause and in the main clause. For example, if we have a look at the first sentence, if it were appendicitis, Charles' pain would be on the right side. So looking at the form of the verb in the if clause, this is the verb to be in the past simple, were. And so if we have the past simple in the if clause, we need to use would form in the main clause. So Charlie's pain would be on the right side. And this is a hypothetical situation because this is not appendicitis, right? This is the second conditional. So, and if we have a look at the second sentence, some of the students have written, if the rash will not go away, we will send him to a specialist. So is it a real or hypothetical situation? Tell me, please.
Real.
Real situation, right?
Yes,
Yes,
ma'am.
ma'am.
Yes. So we will send him to a specialist. It's real, right? So, and it is first conditional. In the first conditional just structure, we do not use future after if. After if, we need to use present simple. So what's the present simple of not go, not to go?
Does not go,
Yes.
like doesn't go.
Doesn't
Does
go
not.
away, we'll send him to a specialist. The next, if it becomes something sinister, the headache would probably be constant. First of all, there was the verb to be, not to become. And if we look at the main clause, would probably be, it shows that situation is hypothetical because we use would in the second conditional just sentence. And instead of becomes, what will be the form of the verb to be in the if clause?
Becomes.
We should use the verb to be. Change
Yes,
the
ma'am.
form. Yes, sorry.
Become.
Ma'am.
No, to be.
Game.
To
So
be.
should we use the present simple or past simple here in sentence 3 in the, after if, in the if clause? Which tense should be used here? If we have would in the main clause, in the if clause, we need to use the past simple, right?
Were.
Yes, exactly, you're right. If it were something sinister, the headache would probably be constant. So this is hypothetical situation because the situation is not very serious, right? Now, number 4, if your father gets any worse, we will probably admit him. Is this real or hypothetical situation?
Hypothetical, ma'am. If it's
Past simple.
if it get worse,
No, it's real. And
Real.
here we can see the first conditional structure. So if and gets present simple, and in the main clause will probably admit him. Do you see? This is real situation. So present simple plus future will. The next, if I did the operation again, I would take greater care. So, and here, how can we describe this situation in this sentence?
Hypothetical.
Hypothetical, because I won't do the operation again, but I'm just speaking about the unreal situation. That is why we need past simple did here after if and would in the main clause. Then number 6, if it were meningitis, your child probably wouldn't be so lively. So this is also okay. I mean, the sentence is correct here. This is hypothetical situation, right? So we have were in the past simple in the if clause and wouldn't be in the main clause. The next is number 7. If I set the exam again, I will prepare myself better. So what is wrong in this sentence?
I would prepare. I said better.
Exactly, yes, I would
Yes,
prepare
hypothetical
because,
because.
yes, this is the second conditional hypothetical situation because we have set in the if clause, which is past simple of sit. I would prepare myself better. Number 8, if your mother needs any medication, we would give it to her. So is it real or hypothetical?
Hypothetical.
Hypothetical. So would shows this, right? And that is why we need to change the form of needs. What should be the form of needs instead of needs? It should
Is it
be
needed?
past needed. Yes, past simple. If your mother needed any medication, we would give her. So you should see if plus past, then would plus verb in the main clause. Now, number 9, if your child will be very dehydrated, you need to bring him into A&D. So here you need, there is no future here, but we remember that we don't use future after if in the if clause. So that is why instead of will be, we need to use present simple. And what is the form?
Becomes.
Becomes.
If your child becomes very dehydrated, it's possible, or if your child is very dehydrated, it's also possible to use it. And the last, if your child stays in the hospital, we will keep a close eye on him. So this is correct because stays. So this is first conditional real situation, and stays is used in the
Real.
present simple, and then we have will keep in the future. So here are the sentences. So in the correct form. So and I see that some students get just very poor score for this task. So, well, and yes, this is about the homework, and now we'll start speaking about psychiatry. And I would like you to have a look at, let's try to make it full screen. Can you see the presentation in full screen?
No, ma'am.
Okay, then we will do like this. Now?
Yes, ma'am. Now it is.
Okay, good. Well, you can see here just the portraits of some famous people, psychiatrists, people who worked in psychiatry. And the task is to match the pictures with the descriptions. I mean, how well you know, so the history, medical history. So who was the person who introduced cognitive behavioral therapy?
Aaron
D,
Beckman.
ma'am. Beck. 1963.
Beck.
D. D picture.
Okay, okay. So, and who described his structural model of the mind?
Freud, ma'am.
Yes, Freud.
Dude.
And who was the first to use the term psychiatry?
Real.
Uh,
That A picture.
Christian Rail, ma'am.
Yes, real
Yes,
here in the
ma'am.
picture, yes. And who introduced lithium for treatment of mania?
Cade,
Kid,
ma'am.
ma'am.
1950.
Okay, I'm glad you know these people and you know something about the history of medicine. And so today we'll speak about psychiatry. So it is important to be aware of is it important to be aware of the history of medicine in general and psychiatry in particular? What do you think of this? What is your opinion? Yes, Prerna?
Ma'am, we should probably know the history of medicine in psychiatry because, ma'am, the theories, it makes us understand how a person's mind works and how it works according to the stimulus, like if a person is angry or emotional or anxious. So, these psychiatrists, they have uh, conducted so many experiments, as well as they know how a person's mind works, how a person react to an emotion. So if we know the history of this kind of medicine, then we will be able to understand more easily. Like we will be able to tell like what he or she is going through, or what he or she should do so that they can recover from their particular condition. So
Okay,
I think it is necessary to know the history.
right. Yes, thank you. So, Ayman, please.
Yes, ma'am. Mama, I also think that it is important to know the history of medicine and psychiatry because it gives us an opportunity to look back and compare over the years the theories and all and everything, if it has changed or what were the beliefs and thoughts at that time and what are that now, so that
Mhm,
we can compare and study well.
exactly, yes.
Yes.
Mhm. Okay, so any other ideas? Mhm. Good, thank you.
It also help like to learn about the behavior of a patient and their the emotional and behavioral disorders. So it helps in that in mental health.
Mhm.
We
So
learn
anyway,
something new about that.
yes, knowledge of history can help in medical practice, right?
Improvement. Yes.
Yes, ma'am.
So and in psychiatry, doctors need to be observant of the patient's appearance, behavior, and manner, as this will help in their diagnosis. That is why we are going to focus on some words that describe people. Have a look at this slide. So here there are some nouns and there are definitions, and the task is to match the nouns and definitions. So, for example, the first noun is aggressiveness. So if you have a look at the definitions to the right, what
Option
is
C, ma'am.
C, will to fight,
Will to fight by
arguing
ma'am.
using
using
forceful
forceful
methods.
methods.
forceful methods? Okay. So restlessness.
A feeling
Inability
of
to
worry,
concentrate.
nervousness.
Inability to concentrate.
Inability to concentrate.
And what about the other definitions?
Continuous movement, ma'am.
Continuous movement, yes.
Continuous movement,
When a
ma'am.
person
Yes, ma'am.
always moves, this is without stopping, yeah. Withdrawal.
Moving away, not
Feeling
wanting
of
to
worry,
communicate.
Withdrawal.
ma'am, a feeling of worry, nervousness. B.
No.
Ma'am, moving
Not
away,
wanting
Yes,
to
this
come.
is moving away, not wanting to
Moving away, not
communicate. This
wanting
is
to
withdrawal,
communicate.
the absence
Yes.
of person here. Distraction.
Inability to
Inability to
concentrate.
concentrate.
Inability to
inability to
Inability
concentrate.
to
concentrate.
Inability
concentrate.
to
Right.
concentrate.
Mhm.
A.
The next is flamboyance.
Elaborate or colorful behavior, ma'am.
Exactly, you are right. Yes. Anxiety.
A
A
feeling
feeling
of
of
worry,
worry,
nervousness.
nervousness.
Feeling of worry.
Nervousness.
Worry and nervousness.
Okay. And carelessness.
Being
Being
not
not
accurate.
accurate.
Accurate or
Accurate.
not
Caring.
caring.
You're
Not
right.
caring.
Okay. So just to make sure that we understand the meaning of these words, and so let us think about their adjectives, the form of the adjectives. Let us change each noun into an adjective. For example, if we look at the first line here, number 1, this is the noun aggressiveness, and the corresponding adjective, what is it?
Aggressive.
Forceful.
Angry.
Aggressive.
Angry.
Aggressive. So please, 2 minutes for you to write the adjective next to each noun here. So start, please. Well, so let us check. And is Arun Chalam here?
Yes, ma'am.
So please read the pairs of words.
Yes, ma'am. Ma'am, for aggressiveness, the adjective word is aggressive.
Mhm.
And for restlessness, it is restless.
Mhm.
And for withdrawal, it is withdraw. For distraction, it is distract. Flamboyance, it is flamboyant. Anxiety, it is anxious. Anxious, and carelessness, it is careless.
Mhm. For distraction, what is the adjective for distraction? Will you repeat it, please?
Ma'am, for distraction, it is distract. Distract, ma'am.
Distracted, yes. So
Yes, ma'am.
Yes, ma'am.
distracted. Okay,
Yes.
thank you. So here are the adjectives here on this slide. You can see them, and this is about distraction. So some humorous just picture about mass weapons of mass distraction. So social media, YouTube, Twitter, Facebook. And so we have written the adjectives, and now let us use them in the sentences just to describe the condition of people here in the sentences. For example, the first sentence says about John. John was about his appearance. He was shabbily dressed and his hair wasn't combed. So which adjective can we use in this sentence?
Careless.
Careless, exactly. So John was careless about his appearance. Please look at the other sentences and think which adjective can better describe the condition of these people. So please, a couple of minutes to you. Start, please. Well, let us check. And let us listen to Madhumita. Are you here? Madhumita? No. So Divya? Can you hear me, Divya? No. Priya?
Yes, ma'am.
So the second sentence, please.
Jane was dash and she barely said a word. When she spoke, she did not look at me. Ma'am, Jane was distracted, ma'am.
Distracted or any other ideas?
Withdraw.
Withdrawn, yes.
Drawn. Yes, ma'am.
Withdrawn. Okay, so the next is, I guess Rajkumar and Badris are absent. And so Prerna, please, the next sentence.
Harry was dash. He couldn't sit still and kept twitching all the time. Harry was restless.
Restless, exactly. Okay, so Nishat?
Yes, ma'am. The fourth one. Mary was very dash. She was focused, but you could tell she was worried about something. Ma'am, anxious.
Anxious. Okay.
Mary was very anxious.
So Prakriti, please.
Pat is dash. She dresses in a quite extravagant and formal cloth with the bright color. That is.
So choose from the adjective that we have written. So who can help us?
Color is
Flamboyant.
Flamboyant, ma'am.
Flamboyant, yes, that is flamboyant. Right. The next one is for Samhita.
Pat is dash. She dresses in quite extravagant and formal clothes
Number
with
6,
bright color.
please. Number
Yeah.
6.
Susan was very dash. She was very argumentative. I did not feel safe and sat with my seat near the door. Susan was very aggressive.
Okay, good, thank you. And Rafael, please.
Yes, ma'am. He appeared dash throughout the interview, looking out of the window as if he was hearing voices. He appeared distracted throughout the interview.
Yes, so this is the way we can describe the behavior of these people. And so you can see The adjectives are already used here in the sentences. And the question, are the descriptions related to mania, psychosis, depression, or anxiety? So which conditions are related to mania? So which ones? So for example, this sentence, like about Pat, she's flamboyant, she dresses in quite extravagant
That is
formal clothing.
related to mania, ma'am.
Yes, this is
That sentence
related
is
to
related to
mania.
mania.
What about the first sentence? Careless about his appearance. So what sign is it? What kind of condition is it? Is it mania,
Is it psychosis?
Maybe psychosis.
So he was careless about his appearance because he was in a low mood. This is the sign of depression. Do you see?
Yes,
And
ma'am.
also about Jane, she was withdrawn, barely said a word.
Depressed.
Also depression. So as
Yes,
for
ma'am.
condition in sentence 3 and
Also,
4,
seventh, we can say that
Anxiety,
he appeared distracted.
yes,
restless and anxious.
number 3 and 4, this is about anxiety. And so if we have a look at number 6, aggressive
Aggressive
Mania.
is psychosis.
This is psychosis,
Psychosis.
right?
Psychosis.
Yes. Fifth is mania. Sixth and seventh psychosis.
Psychosis, aggressive.
Yes,
Okay. So these 4 disorders like mania, psychosis, depression and anxiety, they're affective just conditions. But anyway, they can all have organic causes also. And yes. Well, it looks like we need some time just to start the following task. This is the listening task. And so we're going to listen to information about 4 patients. Doctor describing, 3 patients. Doctor describing 3 patients. And we should make notes about each patient using the appropriate features. So you should draw a similar table and you should make notes while listening about the appearance, eye contact, manner, mode of speech, insight, and doctor's feelings about each patient. So please just draw this table so that we'll be able to make notes about each patient. Do it now, please. So you see, we have less than 1 minute left before the end of the session. So when it finishes, let us just take a break, just 10 minutes, okay?
okay.